Hello there, my name is Dr. 𝗬𝗪 and I'm a functional medicine doctor. And if you're watching this webinar, you are suffering from neuropathy. I'm sorry that you're suffering from neuropathy. I've helped hundreds and hundreds of people recover from neuropathy. So what I want to go over is the 5 must-know labs that you need to get checked and normalized if these things are out of range. Now, one thing when it comes to neuropathy, you need to take a polytherapy approach. So what does that mean? That means the more things that you do to normalize your God-given physiology, your God-given healing potential, you can start to recover. So it's never a monotherapy approach. So monotherapy approach would be doing one thing. You're going to do a polytherapy approach, which is several things. You could do 3, 4, 5, 6, 7, 8 different things to start to turn the needle from neuropathy to healing. So what we're going to be discussing in this webinar is the 4 labs you must know to stop your neuropathy. Okay, the first lab I want to talk about is mold. So a lot of people say, no, I don't have mold. You need to get mold checked out. If you have a chronic neuropathy condition, it could be that you have mold exposure, not from a current exposure, could be current, but it could be from past exposure from 5 years, 10 years ago that's still in your system. Now, when we talk about mold here, mold causes chronic inflammation. When you talk about neuropathy, you have to get your inflammation. Your nerves are starting to degenerate because your nerves are inflamed. Your nerves aren't getting blood flow. Your nerves aren't getting nutrition. Your nerves aren't getting the neuronal flow that needs to happen. And this is caused because of chronic systemic inflammation, and mold can be one of them. Now, if you come down here and you see the testing, so I'm going to bring you to this page where I talk about mold and the significance of mold. So here we are on my website, and I just want to go over this very briefly so you can understand what I'm actually talking about here when we talk about mold. So this is one of my clients that had severe pain, neuropathy, and we found out that he had mold of 5,700, and now we got it down to 0, so it should be less than 200. What I want to show you right here is you can see this person's mold right here, gliotoxin. You might have to zoom in a little bit, but the gliotoxin was 5,764. That was his first test. Then we did several other tests, and let me show you his last test. So his last test down here is actually 0. So it went from 5,700 to 0. Now you can see the dates here. The first one was August 19th of 2020. And then the last one was basically 8 months later. So this is a huge success for this person to decrease neuropathy and inflammation. The next level I want to go over is what we call fasting insulin. Now, fasting insulin will cause systemic chronic inflammation in your body. Just imagine insulin like glass shards on your blood vessels and on your nerves causing damage. So again, we're going to click this, see this testing, and we're going to go to my specific page that addresses that. So here's a blog, and as you can see here is high insulin causes chronic inflammation. This is why you need to get your insulin down to normal levels. So I want to bring you to this lab. So this is a lab that I ran on this client. You can see the insulin over here is basically 38, and then the normal range is basically 2.6 to 24. So we want the sweet spot to be between 5 and 6. So the normal healthy functional range here, when we talk about this insulin here, is between 5 and 6. So these labs are not done in the conventional system. You're going to have to go outside and find a functional medicine doctor like myself that will run these on you and figure out the root cause of the problem. So in this webinar right here, you want to watch that video, or you can watch or listen to the podcast. I go over how insulin causes chronic inflammation. Now remember, it's all about decreasing your inflammation and starting to heal the nerves to your foot. The third lab I want to go over is what we call C-reactive protein, which C-reactive protein is a global inflammatory marker that will contribute to degeneration, neuronal death, and chronic inflammation. So let's hit this button right here, see the testing, and let's go over this. So this is right here. If you watch this webinar, this is a case of mine that came to me, a 41-year-old woman that was housebound, and we did some labs. So you can actually see what labs look like. Then what we actually did is we actually ran this C-reactive protein right in here, and you can see the C-reactive protein is 12.4. So it's basically almost 13. Now we want this to be functionally less than 1. So you can see C-reactive protein is 12.4 there, and you can see the range in here. Just when it comes to the lab ranges, we want this less than 1. So functionally, we want this less than 1. So if you have all these inflammatory markers and you don't address the underlying cause of the problem, your neuropathy is going to continue to get worse and worse and worse, and you're going to go to doctor and not get any results. So if you watch this webinar right in here, this will really give you a really good idea of what normal healthy labs should look like and the kind of testing that we do to get to the root cause of the problem. Then the fourth lab that you should run is what we call homocysteine. Homocysteine is another global inflammatory marker, and specifically what it does, if you can see this artery right here, it actually damages the arteries. Now, if your arteries are damaged, or what they call the very smallest part of an artery is a capillary, that goes deep into your foot, deep into your fingers. So if this is damaging, if your vessels are damaged, it can't deliver oxygen to your nerves. If your nerves are damaged, then they start to degenerate, they start to fire, they start to demyelinate, and they start to cause you a bunch of neuropathy pain at night and during the day. So if you want to see the advanced testing right here, you're going to click See Testing, and let's go to that page. Okay, so in here, what I talk about is high homocysteine, and if I have high homocysteine, you can also have a genetic factor called 𝗪𝗃𝗄. So if you haven't had these labs checked, you need to get these labs checked, because these are very, very critical. The homocysteine will literally damage the arteries and the capillaries that deliver oxygen and blood to your nerves in your feet and in your extremities and in your brain as well. So when you have high homocysteine, it's been linked to dementia, Alzheimer's disease, cardiovascular disease, diabetes. So these are 4 basic labs that need to be checked if you have neuropathy. So this is one of my clients that came in. You can see that their labs here, we started working with them, and their homocysteine was at 13, and then it went up, and then it went down. So you really want to normalize this. The homocysteine on a functional level, healthy normal cysteine should be 5 to 6. Anything above 6, 7, 8 is telling you that you have some damage happening to your arteries. So I hope you found value in this. If you're looking for help, you can get a hold of me. Schedule a Zoom call. I see people all over the world, all over the country. There's no need to suffer. You can get well. You just need to have a guide. That's what my job is. I just guide people out of the mess, give them some very specific direction so you can recover, so you can start to regain your health back and spend kids like golfing or gardening or with their grandkids or traveling or whatever you want to do where this neuropathy is hindering you right now. So remember, with that being said, is where there's help, there's hope. Take care. Bye-bye.